Good afternoon, everyone. I'm Melanie Escher with the Arizona Telemedicine Program in the Southwest Telehealth Resource Center, and you have joined us today for an inaugural Lark Galloway Gilliam Distinguished Lecture. We've got some speakers today. We'll hear a little bit more about them as I get through our slides. So as you were joined today, so this is our webinar series, and we're brought to you by the Arizona Telemedicine Program, Southwest Telehealth Resource Center, the National Reach Coalition. We'll hear from Charmaine about the National Reach Coalition, and then also Mel and Enid Zuckerman College of Public Health here at the University of Arizona. We respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. So welcome, everybody. A few tips and notes when you join the webinar, your phone or your computer microphone, they were muted. Time is going to be reserved at the end for questions and answers. Please use our chat function. And this is being recorded, and you'll be able to review this recording on our ATP website, and there is the URL. We can put that in the chat a little bit later. There's also an evaluation that will pop up when we're done. Please go ahead and fill out that evaluation. And this is, we get a bunch of different ideas from those evaluations for what you would like to hear about next. You can also check our website for upcoming webinars and events. And this is the URL for the evaluation. We'll put that into the chat as well. Again, here's our panelists, and I'm going to introduce Charmaine Ruddock, who is with the National Reach Coalition. And let me go ahead and stop sharing. And Charmaine, go ahead and talk about the National Reach Coalition, please.
Thank you, Melanie. So welcome all to the inaugural Lark Galloway Gilliam Distinguished Lecture. Before I start, it would be remiss of me not to acknowledge that it is a collaboration with our wonderful partners, Arizona Telemedicine Program at the Southwest Telehealth Resource Center, the Department of Health Promotion Sciences at the University of Arizona's Mel and Enid Zuckerman College of Public Health that make these webinars possible. So thank you to Melanie and to Chris and to all who have over the years provided us with the kind of technical support that have allowed us to do this lecture and webinars that we've done in the past and webinars that we hope to do in the future. So this 2024 marks the 20th anniversary of the launch of the National Reach Coalition, a coalition founded by REACH grantees that were funded by the CDC as part of its racial and ethnic approaches to community health initiative to address racial and ethnic health disparities with the ultimate goal to eliminate those disparities and establish health equity. Given that our 20th anniversary comes this year, one of the most consequential election years in America's recent history, members of the NRC's board thought it appropriate to launch its Lark Galloway Distinguished Lecture Series now. Why? Why would we think of it in terms of this 2024 election year? The reason, a little more than 20 years ago, a group of CDC's REACH grantees got together to address a recent development where 5 of the REACH grantees' funding was being eliminated. As we brainstormed at the time, Lark as head of the Community Health Council, a REACH grantee, though not one of those being cut, led us into a strategy session where we decided that those of us who in our respective organizations and community had experience advocating with elected officials for matters of importance could do something about this. And so, led by Lark and others, we reached out to elected officials, to senators and Congress members to champion the cause of these REACH grantees. And we were successful. Their REACH funding was not cut, was in fact restored. And so through those efforts, we successfully realized that not only were we able to do this, but that we could build on the lessons we had learned. That REACH grantees working in communities of color, American Indian, Hispanic, AAPI communities, Black African Americans, that had been historically under-resourced, marginalized, and which had some of the highest rates of health inequities in cancer, infant mortality, maternal health, HIV/AIDS, diabetes, cardiovascular disease. That through the power of community, amidst jointly shared goals, should take on the responsibility to inform and educate elected leaders at the federal, state, and local levels to provide the kind of funding, the resources, and the policies that could make the kind of transformative change happen. A longstanding friend of the National REACH Coalition, Daniel Dawes, has written a seminal book on this subject, Political Determinants of Health. And through Daniel's work, we have understood that the political determinants of health focus on three things: voting, government, and policy. We also, as an impetus for this lecture, had been intrigued by the fact that the University of Wisconsin, through its report on the county health rankings, had been paying particular attention to civic engagement, of which voting is a very important part. And so with that, we decided that we were going to invite them to be part of this lecture to share with us their insights. And so we have put together this panel, reduced it to because we had invited and they had accepted the invitation to participate in this panel, the Lark Galloway's sisters, Elizabeth and Patricia Galloway. Unfortunately, they have a brother who has been hospitalized recently, and having to handle the problems with navigating the healthcare system on his behalf does not allow them to join us this afternoon. But nonetheless, we look forward to having a robust conversation about the political determinants of health, how communities can find traction and their power as they understand this, and what we should do, not only in this election period, but going forward. And with that, I am going to turn it over to Martha Monroy, who is the Vice President of the National REACH Coalition. Martha.
Good afternoon, everybody. And it's my pleasure to introduce our panelists for today. Erica Burrows Girardi, who is with County Health Rankings and Roadmaps at the University of Wisconsin Population Health Institute. And Yvonne Lewis, who's with the Healthy Flint Research Coordinating Center in the Genesee and with the Genesee Health. Erica, I think you were going to go first with some few thoughts.
I'm happy to get us started. We're good? Thank you for that introduction, Martha, and thank you for that opening, Charmaine. I am absolutely humbled and just delighted at the same time to be part of the inaugural Lark Galloway Gilliam Distinguished Lecture Series. So thank you so much. I'm going to share some slides that's going to help guide my discussion. And then I'm excited that I'm going to be followed by Yvonne Lewis, who is going to show you I'm going to tell you a lot about our research and all this stuff, but Yvonne's going to show you what this looks like in action. So I'm more excited about hearing from her. But County Health Rankings and Roadmaps is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. We've been around for since 2010, 2011, kind of predates when I joined them. I joined them in 2015. But over the course of our work, there's two questions that we've always explored. And one is, what are the factors that influence health? And another question that we explore is, how can we create opportunities for everyone to live long? Not just the people who have more money, not just the people who have more power, not just people of certain color, race, or gender, but how can we create opportunities for everyone to live long and live well? And like Charmaine indicated, today I'm going to share some of the research that we have been exploring recently related to civic health's influence on our health and our well-being. So again, that first question that we explore in our research is, what are the factors that influence health? Well, as it turns out, there are many factors that impact our current and future health. And what you see here is what we call our rankings model. And it provides a visual of these factors. On our website, you're going to find at least 80 measures that fall into one of these four buckets of health factors that you see in the darker shade of blue. Health behaviors are the types of factors that people kind of think of first when they think about what is health. Those are the factors that include measures like diet and exercise, tobacco use, those type of individual measures. Next, we have a bucket of clinical care. That's because access to affordable and timely and quality clinical care is another important factor that shapes the future of health of any community. And then there are the social and economic factors. They include education, income, community safety, all of those things that give us the types of social supports needed to enable healthy choices, afford medical care, housing, and manage stress. That last bucket is the physical environment. This is where communities live, learn, work, and rest. And we interact with our physical environment through the air we breathe, the water we drink, our houses that we call home, transportation to work, school, etc. All of these make up our physical environment and can create opportunities for better health in any community. Now, notice in our model, we also distinguish policy and programs. Why? Well, we know that policies and programs can influence how communities may experience any of these health factors. For example, some of you might be familiar with the program called Safe Routes to School. It's a scientifically supported program that increases physical activity. It also has added benefits like pedestrian and cyclist safety. It even has benefits of reduced emissions in the environment. So policies and programs can actually influence all or just some of these health factors. So again, it's well understood that safe housing, access to nutritious foods, livable wages, all of those things outside of the doctor's office influence how long and how well we live. And many of us know this as the social determinants. But one of the questions we at County Health Rankings and Roadmaps have been asking lately is the same question that Daniel Dawes has been asking. What shapes conditions and determinants? Like, what are the policies and the laws, even traditions, that shape a society? Let me put it this way. Who decides which places receive adequate resources for people to live and to thrive? Who decides whether a community has access to safe and affordable housing, good paying jobs? Because all of these are important to health. Well, what we're finding is that these factors are shaped by power and structures, such as laws, policies, beliefs, worldviews, even narratives. So again, health policy researcher Daniel Dawes coined the term political determinants of health to define these determinants. And CHR&R explores the structural determinants of health. Now, the structural determinants of health are a bit broader, but they're very similar. They're pretty much encompass what Dawes has been looking at. So Mike is chatting a link to one of our, but we have a podcast. So he's chatting the link to one of our podcast episodes. And in this particular episode, we interviewed Daniel Dawes about the political determinants of health. Be sure to check out that podcast episode, not now, but another time. But what we're finding is that, same thing probably you already know, people and groups who hold more power shape society's rules. Okay? People and groups who hold more power get to determine what the rules are and how they're applied. And they base those rules on their own values and beliefs or how they think society should work. Ultimately, people and groups with more power are the ones who are deciding who should reap the rewards, who should bear the cost. For example, structural determinants can influence distribution of resources, like whether government funds go toward housing or whether it goes toward policing. So while focusing on the social determinants of health directs us upstream, the political or the structural determinants of health drive us even further upstream. When we look further upstream, we ask the question, who's holding power? How's that power being shared? And how are residents participating in the decisions that affect their future? So to advance health and equity, and that's what we want, that's what we're here for. We want to advance health and equity. We have to go beyond the social determinants. We've been looking at social determinants for 2 decades. We got to go beyond that. We got to go beyond the decisions about saying, okay, well, we need affordable housing. Yes, we know we need affordable housing, but we got to look at shifting power and mindsets. We got to turn our attention to the structures like the laws, the policies, the narratives, all that stuff that sits behind the decisions of whether or not a policy makes things accessible for people. And it will require input from everyone to make these changes. So that's why this year, County Health Rankings and Roadmaps looked at 2 elements of civic health. Now, Charmaine talked about it earlier. She was talking about our civic health report. It came out in March of 2024. And in our report, we identified 2 elements of civic health. One is civic infrastructure. It sounds really jargony, but really civic infrastructure is the places and the spaces where we meet to make our voices be heard, the places that we engage in cultural activities, the places where we feel like we belong, where we are assured of that belonging. Civic infrastructure also means, how do we cultivate those spaces? Like, how do we keep them clean? How do we make sure they're available? How do we make sure they're accessible? How do we make sure they're funded? All of that goes into civic infrastructure. And there's another bucket we're looking at in civic health, and that's called civic participation, sometimes called civic engagement. Those are the ways people engage in a community to improve their conditions. And there's several ways that we can engage, right? Voting is one. But there's other ways we can make our voices be heard. We can advocate, volunteering, mentoring, participating in unions. All of these ways are parts of the ways that we can be civically engaged in our communities. So we look at those 2 elements, infrastructure or the spaces, participation or the ways. Both are important if we are going to make decisions and have a say in our future, both the spaces and the ways to engage. What we're finding though, interesting, or probably not surprising, or maybe not even surprising to you, is that civic opportunities or civic health opportunities are not the same across the country. So, we're in some places of the country, it would be easy to participate. It'd be easy to register to vote. It'd be easy to be able to go to your library and get social services. Other parts of the country, not as much. What we found is that the healthiest counties across the United States, when we look at quality of life and length of life, the healthiest counties have well-resourced civic infrastructure. Remember, civic infrastructure are the spaces where people connect. One of those spaces are virtual spaces. So in the healthiest communities across the United States, they have better access to broadband. They also have better access to local news outlets. They have better access to libraries, and they visit the libraries more when compared to counties that are the least healthy. And these counties also have better social and economic opportunities when there's well-resourced infrastructures. Kind of makes sense. It kind of goes hand in hand. If you got better access to broadband, if you got better access to all of this stuff, the things that you need to thrive, then that brings in jobs, right? So then you have better economic opportunities. It's a cycle that feeds itself. So let's take a closer look at what these differences look like. Now, what you see here are two measures of civic health that we offer at countyhealthrankings.org. Remember, we have over 80 measures. I'm just pulling out two that I want you to look at. Now, I don't have to tell you how important voter turnout is. It is extremely important. And like Charmaine said, perhaps now more than ever, as we're looking at an election that can have a significant impact on our future. Civic participation is just as important. I don't know why people sometimes don't necessarily realize that, but oh my gosh, people don't realize civic participation is so important because those numbers can indicate need for new roads, hospitals, schools, and other public sector investments, not to mention the congressional seats and the redistricting that is tied to the census. And I keep saying civic participation, I'm going to say census participation. So census participation is extremely important. So what I want to do is I'm going to nerd out a little bit because this is really important, but I'm going to break it down. I'm going to share some of the data and the types of data that you can find on our website. My goal in sharing this information is to show you just how important it is to participate in your communities. I want to be able to show you that there is a link between civic health and health outcomes. There is a link. So I want you to see this association here. And this is the reason why we're going to nerd out. I want you to nerd out with me for a few minutes. The blue bars here represent the healthiest counties in the nation. The red bars represent the least healthy counties in the nation. So the pattern that we see in our research is that if you look at voter turnout and census participation, and those are on the curved graphs, what the pattern shows is that counties with higher voter turnout and census participation are also the counties that have better access to broadband, libraries, parks and recreation facilities, and adequately funded schools, and more opportunities to connect through social connections. So I want you to look at this access to adequately funded schools. Look at that stark difference. Look at that. So the counties, the healthiest counties, 10%, the top 10% of healthiest counties compared to the least healthy counties in the country. Look how the vast difference in school funding for these particular, it's stark. It is so stark. And then I want you to look at these maps. Nerd out with me for a little bit more. We started collecting data around 2010. I mean, this information is available. It's publicly available. But in 2010, this is what the map looked like when we looked at the least healthiest counties across the nation in 2010. 10 years later, in 2020, This is what the map looks like. So I'm going to put the maps beside each other. 2010 on the left, 2020 on the right. What do you notice? Do you see a pattern? Well, I'll tell you what the pattern I saw. I've been involved in public health since 2010. We're not making a difference by telling everyone to simply eat 5 fruits and vegetables a day. We're not making a difference by telling people to get in their 10,000 steps a day. It's important. I mean, I still wear my Fitbit. I want to get in my 10,000 steps. Those recommendations are very helpful, but they're a small piece of the equation for better health. We're not seeing the difference that we want to see. And speaking of fruits and vegetables and getting those 5 fruits and vegetables in a day, when was the last time you looked at your grocery bill when you tried to buy 5 fruits and vegetables a day for the entire week? So that brings me to yet another familiar pattern. And that is the social and economic opportunities across the country. Here you see the counties in blue. Those are the ones that have the better social and economic opportunities, and the counties in red have fewer social and economic opportunities. Those in red look a lot like those same spots that we saw from 2010 and 2020. Communities that have been cut off from investments or have experienced discrimination have fewer social and economic opportunities. So these gaps disproportionately affect who? People of color and people living in rural areas. And disinvestment can manifest itself in a variety of ways. It can show up as, well, we have limited public services. Why? We just don't think it's important to invest in that. It can also show up in the lack of motivation from people who do have power, the lack of motivation to even care. I'm not going to worry about it. I'm just going to channel my money somewhere else. We're not going to channel into infrastructure or community development. Disinvestment really hurts because ultimately this inaction, this failure to invest in areas that need it the most only intensifies existing inequalities and impede economic growth. And when economic growth is stifled, we see less opportunities for health. One last map I want to show you. Thank you for nerding out with me. I want to ask you a question. Does this disinvestment happen randomly, or is it connected to history? If you chose it's connected to history, you chose the right answer. Yes. We see notable regions in our country like Appalachia, that's shown here in green, where we have failed to invest in rural economies. We failed to invest in the southern region known as the Black Belt, shown here in orange, where relatively high proportions of Black Americans live. I worked there for years in the Black Belt. There's areas that are just completely destitute and have been that way since the Civil War. And then if you look at the purple counties, where a lot of the American Indian and Alaska Native lands are still held by the folks living there, they are overcoming impacts of history and violence, exclusion, and disinvestment. And so we still see lots of poverty there. So what's the solution? The solution is not just 5 fruits and vegetables a day and 10,000 steps a day. No, in order for us to get where we need to go, we have to improve civic health. And on our website, in addition to the data, we also have lots of strategies that you can explore to improve health in your community. Now, as a reminder, civic health opportunities vary across the country. We just saw that with the maps that we went through. But we have the power to create better civic health opportunities for every community in the United States. If you look at our What Works for Health database, you'll see lots of strategies related to all sorts of health factors. But we actually pulled out a few directly related to civic health. So if we want to improve civic health, we have to improve ways for people to connect. Broadband initiatives are so important because they allow people to engage. It also supports education. You know, you cannot get through school nowadays without having a computer and access to the internet. It's ways that people engage with their doctors through telemedicine. It's ways that people apply for employment. Broadband is essential. Public libraries are essential. We just went through a public fight in the county adjacent to me because they wanted to close a public library. And thank God people showed up in mass and said, you will not close our library. You will find a way to redirect funds so we have a library. Libraries are gathering spaces for people to have social programming, civic programming, cooking classes. We need our libraries. And if you want to deepen civic participation, make sure people have access to being able to vote. Voter registration is so important. We need to improve opportunities for people to vote and make it easy for people to vote, not make it hard. Participatory budgeting is one way that communities can have a say in how public budgets are spent. And one strategy that's showing promise is called, in decreasing polarization, is called public deliberations. It's a way that people can get together and have facilitated conversations about diverse values and perspectives about a topic of concern. So we're going to make sure that you have links to all of this stuff so you can learn more about these strategies. And I want to tell you about other things you can do. All right. Show up to your town halls, show up to charrettes, tell your story to policymakers, tell your stories to decision makers. I love the inspiring story that Charmaine was telling about how Lark showed up for other people, for other REACH grantees. Her funding wasn't even threatened, but she showed up for others. Show up for others. Show up to your town halls. Talk to your elected officials, and talk to your decision makers. Engage the media. Tell your story to the media. Let people know how important health is to your community and your health concerns, your housing concerns, etc. Partner and strategize with advocacy organizations. Don't do this alone. Be a Lark. Be like Lark was. Even if this is not affecting you, stand in solidarity with those who need you. The stakes are too high. And I promise you that when you are helping someone else, you're also helping yourself. And treat the census as if your future depends on it, because it does. The census is absolutely essential to making sure people get the public services that they need. And lastly, by all means, vote. Exercise your right to vote. You know, your voice really matters. Let it be heard. We know research is clear that there is an association between your voice being heard, you having the opportunity to share your story, to advocate for yourself. We know that there's association between that and health. So always do what you need to do to let your voice be heard. I want to invite you to connect with county health rankings and roadmaps. Hey, every county looks different. We have tools and measures for that can help you move forward. And plus, I just want to connect with you and hear your story. So reach out to us and let me get to know you and let me hear about what you are doing in your counties. We also have a presence on social media, and I'm going to invite you to as well. Be sure to sign up for our newsletter. If you subscribe to our newsletter, you'll have access to our webinars and learn about when they are being produced and when they're being live streamed. You will also have access to our podcast as well as all of the other resources and stuff that we offer at County Health Rankings and Roadmaps. So again, thank you so much for allowing me to be able to share. And I'm looking forward to hearing from Yvonne, because she's going to show you what this looks like in action. You know, I nerded you out. She's going to have the fun stuff. So thank you so much.
Thank you so much, Erica. And nerding out's fun. We need both. So, Yvonne, talk about what this looks like on the ground and all the successful projects that Flint has been able and Genesee County has been able to implement.
Thank you, Martha, and thank you, Erica, for sharing all the information with the data, because the data is important. For those of you that are listening, my name is Yvonne Lewis, and I do not have slides today because I have been asked to just have a conversation with you, just to talk with you about our experience here in Flint, Michigan, related to social determinants of health, political determinants of health, overall health and well-being, and what and how the important voice of community makes a difference. I want to also thank Charmaine. Charmaine, thank you for that introduction, because it reminded me of 2000 and whatever that year was, when we as REACH partners, because Genesee County was one of the original REACH partners, and we had the privilege of working with Lark, actually with going on one of the trips to the Hill to talk about how important it was to ensure that funding was maintained for all of the grantees for the work that was being done. Because as Erica showed us, the data does tell us stories. It gives us information about what's happening in communities in terms of the numbers, but it doesn't often show us just how those things are happening and the impact that it's having, and most importantly, what the community voice can do to make a difference. And so I certainly want to appreciate that, because when we initially began to do this work, racial and ethnic approaches to community health, we thought that if we engage the community members and engage the community systems, that we would be able to reduce in our community infant mortality. Because infant mortality at that point, African-American infants were dying 3 times the rate of European-American infants. And the question we asked ourselves was, why was that happening? Yes, the data was giving us those facts, but why was that happening? So in our work with the REACH Coalition, we were trying to find out what happened, why, and what we could do about it. And one of the things that we thought we would do was engage the community voice. If you really want to know what's happening in community, talk to the community and find out what's happening, what from their lived experience, and allow their voices to help us to determine what to do about reducing the complications, the barriers, the situations that we're seeing. And so that's what we did in those first 2 years. And as a result of having community conversations, engaging our hospital systems, our healthcare systems, we were able to reduce infant mortality for a period of time, reduce the number of African-American infants who are dying. An interesting question came up for us in one of our meetings. And that was, is it that we want to reduce the number of African-American babies that are dying, or increase the number of European-American babies that are dying? Now, that's an odd question. But the issue became, what is it that we really want to do? What is it that we really want to accomplish? Overall, we want to accomplish better health for all, but it is important to look at where those differences are and what we can do to make a difference. So I wanted to point that out. And then the other critical thing, and I think right now, Flint, Genesee County was often known for the work that we did with General Motors as an automotive town, particularly as it related to community involvement with the sit-down strike. None of us ever imagined that we would be known nationally, and in some cases internationally, based upon a political decision, a financial decision that was made that affected our community. And now we're known all over as the Flint water crisis. You can Google it 10 years later, 10 years now, and you're still having the question asked, is it over? Because quite frankly, I don't know if it'll ever be over in our lifetime because of the impact that it had on people's lives. It is an ongoing conversation. But from the political perspective, from the decision-making perspective, what happened? So for those of that are not aware, Flint was assigned an emergency manager because of financial challenges in the community. And the financial managers, along with some community officials, made the decision that if we switched the Flint water source, they could save some money. Not a lot of money, and the amount of money that was to be saved, it varies, but You know, someone said at one point, saving $100 by making this decision. The impact thousands, hundreds of thousands of lives. Well, the decision to switch the water source from what we know as the Flint water source to the Flint River created quite a challenge, though we were told that it wasn't going to be a problem at all, that this was going to not make a big difference. We weren't going to see any differences. So that switch happened on February 25th, 2014. It was not very long after the switch, which many of the community residents, when we heard about the switch, didn't think it was a good idea from the beginning because of the history of the river being used for discarding industrial waste, if you will, from the General Motors and the related industries. But we were told it was going to be okay. Not many days afterward, the signs of a problem emerged for community members. The way the water smelled, the way the water looked, and even the way the water tasted and the way the water felt. It felt like hard, the water was harder, people were getting rashes, the smell, not a good smell, but also the water was discolored. We have people who were showing up with bottles of water that were brown. You turn your tap on and the water is brown. Now, I've raised this to say, this is really where the critical input of community voice made a difference. Because the community members, when you talk about your voice matters, your voice counts, your voice makes a difference, in many cases, people don't feel like that's true. But here it proved to be critically true. Because when that happened, people had to take note of it, such that even at the federal level, note was taken. Now, it took a while. Quite frankly, it took longer than it ever should, because even before the water was returned to the main water source, the fact that General Motors, one of the plants here in the community, began to see their parts rusting as a result of the water. They were able to get the water switch for the plant before we were able to get the water switch back for the community members. Community members went to City Hall. Community members went to Lansing. Community members, and you talked about, Erica, partnering with agencies, partnering with the NRDC, the National Defense Council, partnering with the ACLU, getting some assistance. Community members partnered with academic partners, because even though we were saying that there was a problem and noting that there was a problem, it really took some data to help. So this is an important piece too, where it is important that data and the community voice merge and work together, because one of the things that we talked about so frequently here in our community is community and academic partnerships. So I want to digress a moment, because we talk about partnering. One of the things, and advocacy, one of the things in our community early in the 2000s that also happened, and I'm sharing from an advocacy perspective, that many of our community members did not have healthcare coverage. And during a time when there was no healthcare coverage for all in our community members got together and said, through voting of the millage, because you talked about voting, we're voting for a millage for the Genesee Health Plan. We wanted to ensure that all of our community residents had healthcare coverage. And so that was where community in action made a difference, because we were able to offer through the Genesee Health Plan coverage for community residents. And so with all of these things going on, even though there was not the kind of attention given to it that we wanted, continual voices of community made a difference. As I mentioned, town hall meetings were held, marches and rallies, attending city council meetings, visiting the state capitol, addressing elected officials, and documenting the issues. One of our community members, she said, I didn't know what I was doing, but I just started taking pictures of everything. You know, when the water was coming out of the tap that looked bad, I took a picture of it. When there were rashes, I took a picture of it. I talked to other community members. So community members engaging other community members to talk about this issue and make sure that the voices were elevated to ensure that somebody was listening. Now it is 10 years later, and we're still saying we want you to listen, but some of the results for them. I must say, one of the questions that came was, so what caused the problem? What caused the lead to leach into the water? And I want to make sure, because sometimes this is overlooked, that it was a lack of corrosion control that was put into the water through the water system that reduced the ability of the pipes to be maintained, because all of the pipes are made of lead, but that corrosion control helped to cover the pipes in order to keep the lead from leaching into the water. And then, so the voice of community made this become an awareness for us. Also, the elevation in lead, and many of you, if you Google it, you'll hear it again, that Dr. Monahana Atisha, who is one of the leading pediatricians here, was one of the voices who collected data on some of her patients, on some of the children, to ensure, that there was data to support what we were saying. And that led to an awareness that there was increased lead levels in the blood lead levels of children, but also then across the community, how this was affecting others. So what that led to was the ability for us to have lead testing sites in our community. As a result of the water being contaminated, we were able then to get water, because everyone deserves a right to clean, safe water. And so while this was going on, then the water was made available to community residents, but also testing the water to ensure that we understood what the levels were. Because in some cases, we talk about policies too, the lead and copper rule, EPA, was that the action level was 15 parts per liter, 15 parts per billion, excuse me, that they would have some attention to this. But that, in some cases in our community, it was as much as 17 parts per billion and more in some homes of our residents. So it was important. The voice of community was important to make sure that these issues that we were being raised were being addressed. And so there were some changes to the lead and copper rule, proposed change that the action level is reduced to 10 parts per million, so per billion, so that some attention is given to it before it gets to that increased level. Because there, according to CDC, there is no safe level of lead. So even at 10 parts per billion, that's still, if you would, unacceptable, but it actually is reduced, proposed reduction as a result of community voice. So you can imagine now, I'm going to skip because there's a whole lot to this story and I'm only hitting bits and pieces of it. But if you can imagine now, that happened in 2014. And in 2014, we also, in order to address the water crisis, we had town hall meetings, bringing community members to talk about it and answer questions for them that would allow them to understand what was happening and to know where resources were and how to access those resources. We also then had the Healthy Flint Research Coordinating Center organized in a partnership with the University of Michigan, Flint, Ann Arbor, as well as Michigan State University, bringing our academic partners in collaboration with community to say, these are issues, how do we address these issues? And one of the things we wanted to do was ensure that the community was not taken advantage of, but that all of the community would be considered in the research process. So that isn't research done on community, but research done with community, because it was going to be done. Let's see how we can help coordinate that and make sure it's most effective for our community. One of the things that we had done in those early days was a symposium to help the community understand the research that was being conducted in the community. Well, then we hit 2019, 2020, and everybody knows what happened there. We're in a pandemic. COVID-19. On March In March, we're planning for our annual symposium. When we get word that there cannot be large gatherings of over 100 people initially, and then not large gatherings at all by our governor. As a pivot, one of the things that is critically important in partnerships is that you're able to partner well and pivot well. And so rather than being able to conduct the symposium, we began a community webinar, which we call the Flint Community Webinar on Coronavirus. Now, on the heels of the water crisis, where we were no longer trusting our public officials, where we were no longer trusting some of the information we're receiving from our government officials at the local, the state, and the federal level, you can imagine our mayor was involved in making the decision about the water switch at the local level. Our state governor was involved. And then we have the federal level as well, because you have EPA. At all of those levels, there's distrust by community residents. So we wanted, in the face of the water crisis, as quickly as possible, how do we identify credible community voices who can help us address this emergent issue where we were seeing people dying by the hundreds, by the thousands on a daily basis? The webinar provided us an opportunity to galvanize our local officials, our hospital officials, our state officials, our government, even our congressmen would come and talk to us about what was going on as related to COVID-19. The engagement of community is critically important. As you mentioned earlier, in terms of residents' participation, when residents would come on, one of the things that we wanted to do is how do we access, we talk about equity. How do we ensure that all of our community members have access to the necessary resources that they need during this critical time? When we talked about the vaccine, when initially vaccines weren't available, we're just trying to make sure that we get people, making people aware of what they could do in terms of reducing their risk of COVID-19. So that webinar provided that access to that information. Again, when we think about the ability to have people that you know, that you trust, to share information with you, you're more likely to respond. And then access. Where are those access points? We wanted to be sure that places in community where people would go and gather, and our local churches and our health clinics, they would be able to go there and access the vaccines once the vaccines were available, and to tell people this is a personal decision. We want to make sure you can make an informed decision, and therefore here's the information. On a weekly basis for over 133 weeks, we provided that information for our community members. So here is opportunity. Your voice counts, and that's what we want to continue to share. Even today, we're saying to our community, after the weeks, months, and even years of not having all of the answers, not having all of the responses that were necessary, but still to get community voices to stand up, speak up, and let their voices be heard for the mechanisms that are available to us in our community. Who you vote for is your decision, but the question was, do you have the information that you need to go out and vote? So I think I'm just about close to my time for wrapping up my talk, but engage. We're still encouraging, engage policymakers is one of the things, so that decisions that you can influence, town hall meetings and community engagement allow us to influence the thought process of those who are of the decision makers. Show up and then continue to advocate. We're continuing to advocate on behalf of our community. And as I looked at this, Charmaine, and I thought about it the other day, I am so incredibly proud of our community, because as a result of standing up and speaking out, other communities have benefited, even in some cases more quickly than we did. They already have all their pipes changed. We're still working on that. But to know that our experience has not truly been in vain, that others have benefited, but also if we keep standing up, speaking out, and allowing our voices to be heard, critical change can be made and things will happen that will truly make a difference. Take the data. The data alone isn't enough. Community engagement is another part of that. Putting them together makes the difference. Thank you.
Wow. Yeah, both of you, it's just an incredible story. And I love the way that how you complement each other in terms of the importance of creating change. So I have a question. We have a lot of communities that have historically been disenfranchised, whose voices have been ignored, who have been, experienced systematic depression, and sometimes can just get to the point where why should we? Because we've been there before. And you've been able to engage community at such a level for such a long time. How do you deal with those folks who have just sort of gotten so frustrated over history? How were you able to convince them not only to get engaged, but to stay engaged? Yvonne and Erica, either one of you.
Well, we're fortunate to have some individuals that just won't give up. And now the new generation is emerging, and they're even, I mean, the excitement in seeing some of the younger people utilize the technology, that if you talked about broadband, I mean, utilizing the technology, Instagram, Facebook, polls, just so many different ways that they're utilizing the technology to get information out. And some of them, in some of our conversations, they said, how do we, working along with someone that is older and had been in the I'll say in the fight or in the struggle for a long time, and they're really taking the mantle on and doing it. Some people do get tired. But then you try to find another way for them to be engaged. Maybe they can't be on the front line where they were, but they can also engage and share information. And it is true. There are people who are saying, I've talked about it. I don't think it's going to make a difference. And so people do sometimes get tired and say, I'm not going to fight anymore. But the beauty of it is there's always someone else that you can reach out and grab and hold on and hold up and encourage them to continue in the struggle.
And it seems like you're doing that through, intergenerational, so that, won't eat that the older generation is training the next group to come up and pick up the mantle. So Erica, here's an issue that is particularly problematic in our state, where we have large areas of large rural communities, not just rural, but frontier communities, that don't have access to broadband internet. And where, like I mentioned before, the Navajo Nation, it has large areas with food deserts. How can they leverage and for both of you, how can these communities leverage those, and improve their civic infrastructure and raise the voices of folks that are isolated?
It's difficult. I mean, and there's no way around it. I mean, I'm going to be honest. It's really, really hard when you have elected officials and powers that be who are unwilling to see where resources need to be placed. And so that's where the power of community comes in. And that's where you have what I like to call just good old fashioned community organizing. And Yvonne described that so well, where people came together and they basically demanded. And again, not saying it's a lot easier said than done. But what community organizing, one of the tenets of it is persistence, that persistence, that persistence, that persistence. And in partnering with those who really have had experience working with elected officials, is so important. Being able to transfer those skills and knowing that there might be different ways that you can participate, and really leaning on those who have the ear of the elected officials. That's one way. I'm not going to say it's the only solution, but that's one way.
And that's one of the things that I always tell my students is that the best resource any community has are the people, right? So the interesting thing that both of you were talking about is how you develop these diverse partnerships, right? With universities, with physicians, with local officials that were allies. What were some of the strategies that you used? So Yvonne and then Erica, if you guys could sort of share that with some students.
Well, I think one of the things is you're appealing to people's sense of interest beyond themselves. We have senior leadership who are saying, I'm doing this because I'm looking out for the next generation. It may not happen in my lifetime, but I'm concerned about what will happen for those who are coming along behind me. And so I think that it's really, really important just to begin to pull on or even explain. It does take time. You can imagine we've been talking about these issues for a lot of years now. And in some cases, we're still, because policies, and that's the other thing, policies take time to change. They don't change easily or quickly. And so it's important to continue to say, these are things that we need to talk about and discuss, and to ensure that you're encouraging or getting people in place who has similar concerns and willingness to be the voice in those different spaces. I can't be there, but you can be there. Be the voice in that space that can make the difference.
And I want to chime in. I want to just, because when those folks are in places, when we vote them, let's say, into office, it's so important that people realize that voting is one way, and it's such an important way for your voice to be heard, but it doesn't stop there. It's so important that we hold our elected officials accountable to what they say that they're going to do. Like, don't fight for my vote and then forget about me. So holding them accountable by making sure you have constant communication with them is so important. The other thing that I will add in terms of building a coalition and networks is to, it's as simple as this: go into the best neighborhood in your community and just look around in that community. Think about how it smells, how it feels, what the air feels like, what the air smells like. Who's responsible for making sure that place looks so beautiful, that the air is so clean, that the sidewalks are not cracked? Those are the people that need to be at the table. Those are the people that you engage. And my taxes, I'm probably paying more taxes today, or my taxes are just as good as their taxes. You're going to show up. And if you're not going to show up in my community, I'm going to show up at your door with my friends, with my neighborhood, and we're going to hold you accountable.
So it really, the power of people's stories, raising people's stories, raising their voices where they're not traditionally heard, or have not been heard, or have not been, the doors have been closed to them, right? So it's pretty much knocking on those doors or figuring out a way to get them open, right? So with physicians, a lot of times physicians, I know this sounds odd, but I've heard this, that physicians don't feel like they have the power. But they feel they have the power to advocate within the healthcare system, but not outside, right? And again, they don't, in some places they are trained in advocacy, but others don't. And we know that degree, that those letters after their name have power. So how did you engage those physicians and get them involved in the outside of the clinics? And how did you get them into the town halls and out marching with people from the community. Yvonne?
Well, one of the things that we said, I think one of the beauties for us here is our community. They live here in the community. And so they too were impacted by it. And I remember we reached out to one of our hospital emergency room doctors and talked to him about the importance of helping people understand where to go to get tested. And they showed up. I think it's because the community members had such passion about the importance of this, that those leaders who were like our physician community, and we engaged the leader of our community health clinic, federally qualified health centers, and engaging those leaders, they were able to be those voices and say, our place is a place that you can come and get the services that you need. And so I guess it's appealing and they, you know them and they know you. And we had community members who, you can look at them and say, hey, we need your help. We need your assistance in helping get this word out, because it's a critical piece. And then having I would say a non-biased perspective, even though we recognize that this became very, very political in every one of the instances that we've named, they were very, very political. But to have representatives who did not take a political stance, but the stance from a health and a sincere and a humane, this is a human interest person. This is important. This is our lives here. And how do we address it from that perspective versus addressing it from just the political perspective? Understanding, and again, it's really challenging sometimes to think. You do know that the politics makes a difference. And you do want to make sure that you can talk to people in such a way that they recognize that you understand politics make a difference, but this is a life's decision. And we want you to have the information that you need in order to make that informed decision.
Yeah, I think it's really sad how public health is related to politics, because you can't get policies as politics, right? But it is sad that we do find ourselves in a place where the partisan fights have weaved their way into public health, and we don't see the priorities, like we used to. And, sometimes that requires a different angle when you're dealing with these policymakers. Sometimes it requires you looking at the dollars and the cents of it, the economic side of things. And we have found that sometimes that resonates better with our policymakers today, as opposed to leaning only on public health. And it's sad that it has to be that way, but the social, the economic arguments resonate a lot with policymakers.
Did you want to say something?
Are you asking me, Martha?
No, yeah, I thought you had your hand up, so.
I do. Yvonne, I vaguely remember, but I may be confusing it with another crisis. But with the situation with Flint, do I remember it correctly that the authorities that made the decision to switch Flint's water source had actually sort of taken over like a community manager, town manager that had been duly elected, but they decided they were going to displace that person as a decision maker?
No, you're absolutely correct. I think I had it in my notes. I may have overlooked it, but the emergency manager, our community was one of, and this is also a very challenging situation for us, because when you look at the state of Michigan, the only communities that were given an emergency manager. And this was contrary to a ballot vote. So the emergency manager was it was a ballot initiative. And the entire state turned the ballot initiative down, said, no, we do not want emergency managers. But that was overturned in the legislatures under an amendment. Okay, so that's another political process. Things happen in an amendment that you can't undo once it's kind of slipped in there. And the challenge here in the state was that Genesee County, or Flint, excuse me, was one of the communities and the only communities that received an emergency manager in the state of Michigan were communities that were predominantly African-American, low-income communities. And so when we talk about the disparities, when we talk about these differences, when we talk about these issues, it is important for us to look at the ways communities are looked at. And the fact, as you mentioned in your slides, Erica, and the fact that these are communities that this is consistently done. And so one of the questions that came up is, if this were another community in Michigan where the water question came up, would this have happened, or would it have gone as long? And in many cases, when you read the reports, when you read the literature, the answer is, quite frankly, no, it would not have happened in a higher income, predominantly European American community. This would not have happened. And so we do have to look at the fact that these issues are raised with people or that impact people of color in ways that it does not, and I do like this when we say the majority community, because and that's a data point too. You got to time what constitutes majority. But when we're talking about communities that are traditionally marginalized, disenfranchised, not treated properly, and we have to answer that. So you're absolutely correct. One of the things that generated much work here was the fact that we felt like, as a community, our democracy was being challenged. You know, overall, if someone has the ability to change the Constitution and make decisions that overturn your voice, and this is one of the reasons why so many people don't feel like their voice counts today, is because those types of decisions were made and these types of things, these instances do happen. And so we do struggle at times to tell people, yes, your voice counts. And I think we're seeing that. Your voice counts. It makes a difference. But it also really is important for us to help understand, if we don't get out and continue to speak our voice, it will not get any better. It only allows these stigmas, these challenges, these disproportionate allocation of resources to happen in ways that continue to devastate communities over and over again.
Martha, I didn't take down my hand because I had a second question for Yvonne, and it has to do with allyship. Because Yvonne, I remember that it was a white female pediatrician who started to draw a lot of national attention to this crisis that was happening in this predominantly Black community. And so in terms of, I'd love for you to comment on that.
So Dr. Mona is an immigrant, and I just looked it up a minute ago and I did not, but she talked about, and she was the physician that received, how do I say this? And she tells about it in her book, but she received a challenge from one of her other medical colleagues that she could not ignore this issue. She was seeing babies, and when she talked about it, and I just read a little snippet, it said that she was told there was no corrosion control put in the water. So without the corrosion control, it led to the lead issue. And one way to identify that was to do the research that she did to identify lead levels in children. Now, we all know babies and seniors get a lot of attention, but babies most often. And that is what really brought this more to the fore, is because people are saying Our babies are being poisoned. And the neurotoxin that lead is increases the problems for children over time. So in looking at that, then she was able to pull the data, and even though she was a well-prepared physician, her data was challenged as well, that it was not accurate data. And so she had to fight to say this and stand that the data that she provided about the increased lead levels in children during this time period constituted the issue that needed to be addressed, that is still being addressed today. So some things have been put in place. We have the program called RX Kids that allows mothers, because again, we have mothers who are feeding their baby and families who are making formula with lead tainted water. We have pregnant women who are drinking the water. And the stories go on and on that we could tell you about, but so many people were impacted. But that instance, or not instance, but that issue of talking specifically about the infants and children who were impacted by the lead exposure raised that level of attention even more. So allies, yes, are critical. Community members had to, continue to get that voice out. But it wasn't until somebody who had the influence, right, who could get the ear of the individuals where it would make a difference, so that even more community voices could be heard and some action could be taken to make a difference.
But it comes down to making sure people recognize that the shared humanity, right? One of the things I wanted to bring up has to do with climate change. One of the things we know is that in emergencies, in natural disasters and other emergencies, communities of color are often left out, are not being served, and this continues to be an inequity. And with climate change, we're going to see these factors increasing. And in addition, what can we do? I mean, especially in the face where so many people deny that this is existing, and that as FEMA, the resources that need to be associated with FEMA are reduced, and that a lot of times, in particularly communities where they may not speak English, or they may be afraid of authorities for the reason why some of them have left their original countries. And I know how can you help engage those folks? How should we be raising their voices in the face and making sure that these communities are being served during these natural disasters? Because they're just gonna continue to increase and further complicate already the inequities that are already facing these communities.
Yeah, I mean, and again, I don't have all the answers, but what I can say is this is where I've seen universities, research centers be really particularly helpful with being able to provide that data, because you just can't deny it, right? You can't, it's hard to deny. I really value what Yvonne was saying about centering children in terms of telling our story, because they are our future. They do have the ability to help people see humanity and stand in solidarity with each other. So centering children with that, but those strategies of engaging your researchers around this is so important, and telling the stories from the children's perspective, even having children doing photo voice projects and stuff like that. It's a wonderful way to engage children and help them be part of the data collection that's needed to show the impact and how communities are being harmed.
I think another thing too is going back to that issue of allies. One often as a community member, sometimes you don't think about it in terms of a research project or a data collection in those ways, but having allies. I'm reminded so many partners that I take a long time just giving reference to a number of our community partners, because one of the things with our Flint Center for Health Equity Solutions, that was a part of it with Dr. Deborah Verholden, we were able to talk to the community about different ways and different things that affect the community, talking about the water crisis with our university partners at Michigan and Michigan State, is relating those inequity issues to the environment, because we talked about environmental crisis. We have incinerator project that's put in the heart of an African American community, a poor community, that was not allowed to be put in another community. And so when people begin to think, as a child growing up and then wondering where the asthma came from and the other respiratory problems came from, it's important to have community partnerships and being able to engage with your academic partners to allow you to understand the breadth of these issues and how they impact us as a community, because sometimes you just don't know. You know what you're living and you're experiencing, but it isn't always connected to a public health issue or like you're saying, an environmental issue in that language, utilizing that language that helps to make it clear. It isn't always in that way. And now, as we're talking about it, looking at it from the political perspective, it raises the level of understanding that community members have about how to engage in these conversations. So the cross conversation, we call it cross fertilization, bidirectional learning, however you want to call it, community learning from the academic partners, the research partners, and the research partners learning from community, understanding that language, how to take what community speaks to make it academic speaks, to make it doctor speaks, to make it legislative speaks. So we have to figure out how to talk across these different communities, because it really is going to take everybody to be a part of it to truly make the difference. And I think about one of the doctors in our partnership, Dr. Susan Wolf, was able to take just amazing types of examples and show just something in your kitchen that you would use to give you an understanding of what happens medically. And so it's really so important that we are able to have these conversations. And so we talk about in some of our work, we talk about dialogue sessions and community conversations that allow us. It's an ongoing process. We've had community members just recently. We had a conversation to talk about what's going on post-COVID. If you can call this, we can call it post-pandemic, but it's still COVID, right? And people are saying we still want spaces to talk. So what do we do now? It's not over. So what do we do now? And so we know that there are potentially emerging new things coming down the pike. Some new crisis may evolve. What do we do now? Where do we go to continue to have conversations about these issues that affect us in community and learn how to talk to each other across the different spectrums or realms or whatever you want to call them? So how do I make sense of the data? We're talking about now implementation, dissemination and implementation science. How do we take what's been learned and make it relevant? Can we take that and take it out of an academic journal and put it into a newspaper or a newsletter, so somebody who doesn't go to University XYZ can understand how it's affecting them on block ABC?
Yeah. So, I'm sorry. Go ahead, Yvonne.
It's an ongoing conversation. I don't think we'll get to the end of it today, or will we have all the answers today, but I think the conversations are worth having so we can figure this thing out.
No, I love what you're saying, and it just reminded me. I have a daughter-in-law who is a nurse, and she was telling me that when she was in school, earning her nursing degree, about the different tools that she was learning. It was different from the way I learned public health. So I want to tell folks if there are students or if you're in school and you have an interest in public health, if you have an interest in the medical sciences, being a doctor or being a nurse, what have you, um, know that how important it is to pay attention and to engage with community. This has to be a part of your work. It has to be a part of the way you do things. We have to do things in a different way now. Community is so important. I went to the doctor today and I'm very fortunate. I have one of these like little old school doctors. She's like 75 years old. She still takes notes in a notebook. She doesn't barely knows how to use a computer, all this stuff, but she listens to me and I tell her things, and she's like literally like, I don't care what these people, I'm listening to my patients. Be that kind of doctor, be that kind of nurse, be that kind of public health practitioner that realizes how important it is to have community voice as part of your work and your learning.
I think one of the other things that we say is we think about it, and again, I have to give credit to all of our community members who are still out, making this working and fighting this fight, because it's an ongoing thing. But to encourage them, those who are in the decision-making seats, think about the fact that you live in a community. And what would this be like if this was in your community? How would you want it to be? How would you want to make a difference in your community? And for those who have a different lived experience, take the opportunity to communicate or drive through or walk through or spend time in a community that doesn't look like you, a community that doesn't have what you have, and then ask yourself, what would it be like if I lived in this community? And how would I want it to be? And what would I do to make a difference?
All right. I think that's a great way to end it. This is Mike. I'm with the NRC. I just wanted to share some of the comments. Allies are critical, Erica said. Carrie saying yes, money return on investment. Leandris, thank you. Charmaine and Yvonne, today's webinar has been a celebration of reach and why its original model was and is so effective. Thank you. You all remain my heroes. Thank you very much. And Charmaine saying, we thank you for your leadership at CDC, Leandris. That has continued to spotlight health inequities and the need for communities to be empowered to challenge the underlying factors of health disparities and the status quo. And thank you, Alejandro. I am LinkedIn. We are working on that in the process. Links for our NRC social media is in the chat as well. And if you want to sign up for our e-blast and just find out about upcoming NRC news and events, just email me, micjohnson@institute.org. I take it back to Martha or Charmaine or Melanie to finish us out. Thank you, everyone.
Thank you, everybody. Charmaine and Martha, a couple of closing words for today. Charmaine, you're muted.
Charmaine, you're muted.
Thank you for moderating this conversation. I want to thank Yvonne and Erica. As part of as part of honoring Lark for this political determinants of health effort, the NRC also funded 3 community groups to have community conversations about voting as a determinant of health. That work started a few weeks ago, and it's going right up until the very eve of the election. So it goes right up until November 4th. We cannot emphasize enough, as you heard Yvonne talk about communities, we cannot emphasize enough the fact that folks have to vote. The fact that even though Yvonne talked about a challenging situation where the voice of the people through their vote was being challenged or almost overturned, it still means that the vote is our power to change things, to make a difference, to have things happen. And so this must continue to be emphasized in the work of addressing health disparities and the establishment and promotion of health equities. So, Erica, thank you for allowing us to geek out with you, for the data you provided, which was so digestible. Erica, we thank you for taking us on the journey. It was such a powerful presentation. Erica and Yvonne, it was a wonderful pairing with the two of you. And on behalf of Lark's family and the NRC, I can almost feel Lark's presence saying, yay, you guys continue to do this amazing work that you're doing. So thank you. And thank you, Martha, as well. And I know Melanie usually wants to remind us of something that I'm sure I've forgotten.
Martha, you have a couple words before we close up?
Yeah, I just want to say thank you for letting me be a part of this. I was geeking out, both of you. I mean, it's just, I love just listening, and I love the power of stories, and I love upraising the power of community and the importance of community and research together. So thank you.
Great. Thank you again. As like I said, I'm Melanie Escher with the Arizona Telemedicine Program and Southwest Telehealth Resource Center. Thank you again, Charmaine and Martha, for helping put this together, and Michael, who's in the background. Of course, we've got Denise, who's also working with us, and Chris, my own technician in the back. And again, Yvonne and Erica, thank you so much for volunteering your time and presenting this information. Very powerful. One of the reasons why we like to be involved with this. So please keep in touch with us at Arizona Telemedicine Program, Southwest Telehealth Resource Center, and the NRC. I'll be sending out a little thank you email to everybody about some of the information that was sent and all of the links that Michael shared in the chat. So if you missed them, don't worry about it. We'll make sure that you get them. And we look forward to the next in this session, and we will let you know. Thank you again, everybody, for joining us.
Thank you.
And have a
Melanie,
great rest.
you
Yes.
did remind us about the survey.
Oh, there is an evaluation. It'll pop up behind it'll pop up behind when we close. It'll pop up behind your screen here. Please go ahead and fill out that evaluation and let us know what you think, and any other topic ideas that you are interested in hearing about, so that we can share them with our partners and get some more information to you. Thank you again, everybody, and thanks, Charmaine.
Thank you, Melanie. Thank you, Chris, as always. Bye, guys. Vote. Don't
That's
forget,
right.
vote. All right. Take care, guys.